Hi there! Today we'll cover the causes, symptoms, diagnosis, and management strategies of cardiogenic shock. Cardiogenic shock is a condition where the heart cannot pump sufficient blood to meet the body's needs, leading to decreased cardiac output and tissue perfusion. Now let's review the role of the heart to get a better understanding of why cardiogenic shock happens. The heart serves as the body's primary pump. It receives oxygen-depleted blood from the right side and propels it to the lungs. There, the blood is oxygenated and carbon dioxide is removed. The left side of the heart sends oxygenated blood into the aorta. From the aorta, numerous arteries branch out, distributing oxygen-rich blood throughout the intricate network of vessels to nourish the organs. Cardiac output is defined as the heart's blood pumping capacity per minute, normally 4 to 8 liters. Cardiac output is determined by the person's heart rate times the stroke volume. Stroke volume. This refers to the amount of blood ejected from the left ventricle with each heartbeat, typically ranging from 50 to 100 milliliters. Stroke volume depends on 3 factors. These 3 factors are preload, contractibility, and afterload. Preload is the volume of blood in a ventricle before a contraction. Contractibility is the strength of contraction, and afterload is the resistance against ventricular contraction. Now let's move on to what causes cardiogenic shock. The heart can experience contracting issues, otherwise known as systolic dysfunction. In this condition, the heart struggles to pump blood effectively out of its chambers and into the body. As a result, cardiac output decreases, impacting tissue perfusion. The heart can also experience filling issues. This is called diastolic dysfunction. The heart's chambers fail to fill properly during diastole, which is the relaxation and filling phase. Consequently, blood cannot be adequately pumped to nourish the body's tissues. What is the most common cause of cardiogenic shock? The most common cause of cardiogenic shock is acute myocardial infarction, also known as a heart attack, caused by a blockage in the coronary arteries. These arteries supply oxygen to the heart muscle cells. When blood flow is severely reduced or blocked, heart muscle cells begin to die. Other causes include myocarditis, endocarditis, dysrhythmias, and pulmonary edema. Now let's move on to how the body reacts to cardiogenic shock and the pathophysiology involved. The heart's ability to pump blood is compromised, leading to insufficient blood flow to vital organs. Due to inadequate blood flow, blood pressure drops significantly. As the heart struggles to meet demands, it speeds up to compensate. Reduced blood flow affects the gastrointestinal system. Poor perfusion leads to cool, pale skin. Fluid buildup, pulmonary edema, causes crackling sounds during breathing. The kidneys respond by retaining sodium and water, leading to sodium and water retention. Kidney perfusion decreases, resulting in decreased urine production. Insufficient oxygen delivery leads to bluish discoloration of skin and mucous membranes, resulting in cyanosis. The body compensates for hypoxia by increasing breathing rate, resulting in hyperventilation. Now let's review nursing interventions and treatment. Regularly assess fluid. Use parameters such as blood pressure, heart rate, rhythm, urine output, skin color, capillary refill, and lung sounds. Use caution with normal saline due to potential pulmonary edema. Fluid challenges are generally not recommended for cardiogenic shock. Use tools like pulmonary artery wedge pressure and central venous pressure to monitor cardiac function. Administer medications to optimize preload, afterload, and contractility. Examples include diuretics, vasopressors, and vasodilators. Consider intra-aortic balloon pump placement to improve coronary artery blood flow and increase cardiac output. It assists the heart by inflating during diastole and deflating during systole. Now let's try a review question. 1. A patient is being treated for cardiogenic shock. Which statement below best describes this condition? More than one answer may be used. A. The patient will experience an increase in cardiac output due to an increase in preload and afterload. B. A patient with this condition will experience decreased cardiac output and decreased tissue perfusion. C. This condition occurs because the heart has an inadequate blood volume to pump. Or D. Cardiogenic shock leads to pulmonary edema. And the answer is the answers are B and D. Cardiogenic shock occurs when the heart cannot pump enough blood to the body, causing a decrease in tissue perfusion, thus causing damage to organs. Like this video if you want me to start adding more NCLEX practice questions. That's all for today. Thanks for watching. Comment below what part of this video you found most interesting. Visit my channel for more nursing videos. Thanks and see you next time.